CPR stands for cardiopulmonary respiration, which is a life-saving technique composed of two life support techniques, artificial respiration and artificial circulation. Physiologically, both of these processes are crucial in keeping the body's cells alive. Respiration is a broad term encompassing external, internal, and cellular respiration. External respiration is the physical inhalation of air using the muscles in the ribs and the diaphragm. It is a precursor for internal respiration, in which oxygen-rich air mixes in the lungs exchanges with waste CO2 in the blood cells. The oxygenated cells are at this point ready to be spread to the muscle and organ tissue throughout the body, so that they can perform cellular respiration. Cellular respiration is the process that all cells in the body go through. It converts energy stored in covalent bonds of sugar molecules to convert to a form of energy usable by the body, so that they can turn sugar into energy. Cells have to perform this process in order to survive. When it comes to getting oxygen to all the body's extremities, this is where the circulatory system comes in. The heart pumps oxygenated blood and other nutrients throughout the body, and removes waste products. As such, both of these processes are essential in keeping the body alive, and are therefore both replicated in this technique. Chest compressions represent artificial circulation and should be performed on their own if barrier devices are not present. On land, CPR should begin with compressions, then carry on at a 30-to-2 ratio. To begin with compressions, landmark between the nipples for an adult or child. Place one hand on top of the other and lock the elbows straight for vertical compressions. Fingers should be interlaced and lifted to perform compressions with heels only. Compression depth should be about 1/3 of the chest diameter. On a child, compressions can be performed with 1 or 2 hands. On an infant, compressions should be performed with 2 fingers, landmarking a finger width below the nipple line. Rescue breathing represents artificial respiration and should be performed on its own in a case where a hard surface is unavailable for compressions. For example, a water rescue with a rescue board. Don't do rescue breathing without barrier devices. Rescue breaths should be performed once every 5 seconds for adults, 3 seconds for kids, and a small puff of only about a cheekful of air, enough to see the chest rise, for infants. If there is no specially sized mask, and the infant's face is too small for a regular mask, the mask can be sealed as shown. If the stomach begins to fill with air, readjust the airway and reduce breath volume just enough to see the chest rise. If the victim throws up, the mask should protect you, but roll the victim into semi-prone and scoop out the vomit before continuing with rescue breathing. An AED, or automatic external defibrillator, is an extremely important piece of equipment that is designed to restore normal rhythm to the heart with an electric shock. In conjunction with CPR, an AED greatly increases the survival rate of cardiac arrest. Make sure only to use an AED where the environment permits. Do a splash test to the ground where the victim is resting, and be sure to get the AED on the victim as soon as possible. Once the pads are on as shown, and the AED is on, the AED analyzes the heart rhythm. Stand back and don't touch the victim. The AED will advise a shock or not based on this rhythm, and will instruct to continue CPR for 5 cycles or 2 minutes before analyzing again. Make sure everybody and everything is clear of the victim before administering a shock. Ensure that the victim's chest is dry. When assisting children less than 8 years of age, focus on airway and breathing, as those issues are most likely to have caused cardiac arrest. Some AEDs are equipped for child victims and have child pads that may adhere to the back and the front. If child pads aren't available, adult pads should be used, but child pads should not be used on an adult. If the victim has excessive hair to the point that the pads don't stick to the skin, shave the area to ensure the pads adhere. If the victim is pregnant, continue with AED protocols. Saving the mother is the best way to save the infant. If the victim has a medicine patch, be sure to remove the medicine patch while wearing barrier devices and wipe the area clean before attaching the pads. If the victim has piercings, on the chest, place the pads around the piercings, as they will usually not directly interfere with the zone of contact. If the victim has a necklace, move it up, don't tear it off. If the victim throws up right as the shock is about to be delivered, deliver the shock first, then deal with the vomit. If the victim has an embedded pacemaker on the right side, place the pads at least 1 inch away from that pacemaker. That's CPR with AED.